So thanks, Laurie, and hello, everyone. Uh, Qualitative research is at one end, at least to me, at one end of the continuum of the range of methods used in healthcare settings. And this presentation is perhaps the beginning of the conversation in our department, perhaps. While I have good experience conducting qualitative research, my work in healthcare settings has just begun. So I look forward to your questions and towards the end of this presentation. My topic, qualitative research design in healthcare settings. Qualitative research design in healthcare settings. This wise gentleman, you know who he is, once said, and I'll give you a few seconds to read this comment of his, this quote. Not everything that can be counted counts, and not everything that counts can be counted. Albert Einstein. I think that is saying something that has to do with the differences between qualitative research, qualitative and quantitative research. And think of a healthcare scenario or a phenomenon which cannot be assigned a number. Think of COVID-19 patients admitted to the ICU, terminally ill. How do you quantify this situation? The patient or patients are likely unable to see their loved ones. How do the providers attend to this patient or to the patients in the ICU, at the same time communicate with their relatives, and at the same time ensure their own well-being? This scenario is hard to quantify. Yes, we know the number of beds, we know the number of medications, but there are life stories behind these patients. So the scenario is hard to quantify, but it opens our minds to the potentials of qualitative research. So what is qualitative research? It is strategic, as in it takes into consideration implications to the context of the study and the strengths and weaknesses of the approach to answer the research questions about a particular phenomenon. It systematically uses a predefined set of procedures to answer the research questions. It collects evidence on participants and their environment. It produces findings that were not preconceived, but based on participants' experiences. It produces findings that are applicable to other phenomena. And overall, it seeks to understand a particular phenomenon or phenomena from the participants' perspective of their experiences. The researcher's bias is bracketed while seeking to highlight the pure experience of the subject or community. Qualitative research is effective at capturing values, options, behaviors, and social contexts of populations. So if you notice there that I have bold fonts. These are important words with regard to qualitative research. The researcher endeavors to bracket his or her perspective of the participants' perspective of their experience, in that they set aside their biases and present to the audience or write in their manuscript the pure verbatim, the findings that they've collected from their participants. No doubt, healthcare providers and their patients operate within what I call a socio-clinical, that might be an odd terminology, a socio-clinical interpersonal context, which is subjective and impossible to be completely captured in numeric data. Think of the patient's perspective of their experience. Then think of the provider's perspective of the same experience. We all have different backgrounds, which shape the way we process and experience a phenomenon. Qualitative research methods enable investigators to obtain insights into what it feels like to be another person and to understand the world as others experience it. And so here I want to give an overview of the differences between qualitative and quantitative research characteristics. For the first bullet point I have here, quantitative researchers use more or less a deductive approach. And this involves developing generalizations based on a limited sample. For example, and look, I did this on purpose. The last 5 jokes given in a research presentation was based on Luke, right? So the researcher generalizes that all jokes given in research presentations are based on Luke. But is that so? And just in case someone is watching this video in a future presentation, Luke is a great guy. That's my joke for this presentation. Qualitative researchers, though, take more of an inductive approach, where he or she begins the research process with a completely open mind. This is essentially the reverse process by arriving at a certain conclusion based on observations and experiences, right? So the qualitative researcher looks at the research phenomena from a different perspective. Let's look at the third row for the second characteristic here, type of data. And I have an example to illustrate on the next slide. So for quantitative research, data is numerical. Qualitative research, non-numerical, narrative, and visual data. And so first, another definition of qualitative research. It has to do with the collection, analysis, and interpretation of comprehensive narrative and visual, such as non-numerical data to gain insights into a particular phenomenon of interest. Take a few seconds to look at this picture. What do you see? What do you see? This is a recent event in downtown Fort Worth, where members of the community stood in a line to receive COVID-19 vaccines. Of course, I'm joking, it's not true, but the picture is saying something here to us. From a quantitative perspective, there are 6 individuals standing in line to receive the vaccine. I believe there are 4 females, I believe. Then from a qualitative data standpoint, it was a cold day, right? The patients were 3 feet apart instead of 6. That's what I think. That's what I'm seeing. 2 of the individuals had to leave work for 3 hours in order to make their appointment. And you don't know this until you start talking to the individuals. And there are a lot more things we can see in this picture. So there's always more to it than what the eyes are telling you. We cannot readily see the life stories of the individuals which played out in them being in the line. There are questions about the equity of the distributions of vaccines. We can see members of minority communities and elderly persons in this line. So again, there's always more to it than what the eyes can see. And this is what qualitative research helps us to understand. Research problem. And we'll discuss in more details in a few minutes, but for now, it might be troubling to the ear of quantitative researchers when I say that qualitative researchers often avoid stating the hypotheses before data are collected. So for quantitative research, hypotheses and research procedures are stated before beginning the study, right? For qualitative research, research problems and methods evolve as understanding of the topic deepens. So as the researcher interviews the different members of the community standing in the line to receive the COVID-19 vaccine, he started to realize that his propositions were not exactly correct. He needed to rephrase his research questions and perhaps his methods and make arrangement to visit the participants at their homes to understand better perhaps their socioeconomic situations. This will become clearer as we go forward with the presentation. With regard to manipulation of context, there is some manipulation of context as in within quantitative research, as in establishing control and experimental groups. On the other hand, qualitative researchers describe the participants' experiences as is, right? Regarding sample size, in quantitative research, the researcher can use large secondary data sets. For randomized experimental studies, it might be impractical and expensive to include a large sample. But with regards to qualitative research, the sample size depends on whether the data has become saturated. For example, after interviewing 5 individuals who stood in line to obtain their vaccine at the Fort Worth location noted earlier, the researcher noticed that they were all sharing somewhat similar perspectives on their experiences. This is referred to as data saturation in qualitative research. In other words, there was nothing new to learn. However, the researcher may also notice that the elderly participants had a unique story, or the African American participants were providing certain information that was unique to that demographic group. And in this case, the researcher may interview additional participants of the same demographic group to further obtain a complete picture of what was going on. Research procedures. The quantitative approach relies on, obviously, statistical procedures, while the qualitative approach relies on categorizing and organizing data into patterns to produce a descriptive narrative synthesis. Participant interaction. Little interaction for quantitative and extensive reaction for qualitative. For qual, it depends on the type of method. Think of a phenomenological or an ethnography or a case study, each of which requires the researcher to spend quality time with the participant and within the participant's environment. We will look at a little closer at these methods the next time we meet to discuss qualitative research. Well, let's go on. Underlying belief. Now, this gets into the epistemology of things. And while quantitative research is based on a stable and predictable world that can be measured and is generalizable, qualitative research, on the other hand, methods are based on different beliefs and designed for different purposes that quantitative research methods doesn't. For example, qualitative researchers do not necessarily accept the view of a stable, coherent, uniform world. They argue that all meaning is situated in a particular perspective or context. And because different people and groups often have different perspectives and context, the world has many different meanings, none of which is necessarily more valid or true than the other, right? Now, it is important to understand that qualitative and quantitative methods are on a continuum of tools designed to collect, analyze, and report the different aspects of a phenomenon of interest. There might be a research question or questions which are better served by adopting simultaneously the strengths and of both qualitative and quantitative methods. And this is referred to as mixed methods. So now that we have looked at the differences between quantitative and qualitative approaches, I want to take you through a few specifics about qualitative research design. And I'll reference Joseph Maxwell's materials quite a bit. We will look briefly at the following. Why do I want to do a qualitative study? What goals can qualitative research help you achieve? Conceptual framework, what do you think is going on? Research questions, what do you want to understand? What is a research hypothesis in qualitative design? We'll look briefly at a few qualitative methods, and then we'll finish off by looking at qualitative research in healthcare settings. So why do I want to do a qualitative study? It's important to recognize that qualitative research is not easier than quantitative research. Avoiding statistics has little to do with the skills required for qualitative methods. And I've included here a qualitative methods map just for showing, but it is quite iterative and requires critical thinking, just to make the point that it's not as easy as it looks. So choosing a research method, qual or quant, should be compatible with your research goals, research questions, and the phenomenon or phenomena, plural. So as said, the method should be determined by the research questions. And if not, you are in danger of creating a flawed or biased study. So what goals can qualitative research help you achieve? The strength of qualitative research derives primarily from its inductive approach, its focus on specific situations or people, and its emphasis on words rather than numbers. So the goals include to determine the participant's perspective of his or her lived experiences of the phenomenon that we're researching. to describe the context in which the participant acted and what influenced his or her actions, to identify emergent phenomena and influences which shape the complete picture, to understand the process or processes by which the actions occurred. The focus is on the process, and take note of this. There's a difference between qual and quant. The focus is on the process rather than on the outcome. Now, it helps us to develop causal explanations. And the sub-bullet point here, quantitative researchers tend to be interested in whether and to what extent variance in X plays a role in causing Y. Qualitative researchers, on the other hand, tend to ask how X plays a role in causing Y, what the process is, the context, X and Y. And another goal is it helps us to develop theories that are experientially credible to the population you are studying. Experientially credible because you're looking into the life experiences, the lived experiences of your patients, of your providers. And so it is experientially credible. It resonates, or it's applicable to a setting or a population that is somewhat similar, at least, to the ones you're studying. And it also helps us to conduct formative evaluations to improve practice by engaging the practitioners and research participants. And I think this is very applicable in healthcare settings where you have conversations with patients, you have conversations with providers, and the findings help to inform policymaking and decision-making within the healthcare system. Now, conceptual framework, what do you think is going on? And this would take a philosophy course to cover, but I want to briefly mention that a qualitative researcher necessarily adopts a certain lens or theoretical framework from which to report the findings. So here's a definition that I put together. The conceptual framework is a theoretical lens, including concepts, assumptions, expectations, beliefs, and theories that informs the research design. It informs the method, guides the analysis of data, and frames the presentation of the findings. So as an example, let's reflect on the picture of the vaccine line that we mentioned earlier. One researcher may look to analyze the participants' experiences from a gender, say a feminist standpoint. Another might use a critical race theory. But then we have intersectionality, as demonstrated on this picture, suggests that individuals' perspectives of their experiences can be looked at from the intersection of more than one theory, such as gender, race, or race class perspective. So think of the picture. We could look at the experience of an African-American woman. We could look at an older and say someone from a low economic status group. So the point is conceptual framework gives us lens on to use when we are analyzing the data we collect through qualitative methods. And that's, I believe, that is enough for this presentation on conceptual framework. Now, research questions. What do you want to understand? What do you want to understand by doing your study? Or at the heart of your research design, really. They are the one component that directly links to all the other components of the design, your research questions, right? So locking onto your research questions before having a pretty good sense of what your theoretical, methodological commitments and options are, and implications of these for your questions, creates a danger of what quantitative researchers call type 3 error. You're answering the wrong question. So for this reason, qualitative researchers are likely to revise their research question after a significant amount of data have been collected and analyzed. And I know quantitative research might cringe to hear that. So let's look at two examples. We'll look at a research question, a quantitative research question, and then the qualitative version of that same question, perhaps. These are my questions. They're somewhat novel. So for quantitative, what is the average length of stay for COVID-19 patients at Cokes in the year 2020? You can put a number to this question. It's quite descriptive, right? Now, from a qualitative perspective, you could phrase the question this way: how do COVID-19 patients describe the quality of care received during their stay at Cokes for the year 2020? So patients will have their own perspective of their experiences during their stay at the hospital. And this will depend on their expectations, their sociocultural background, etc. So it links us back here to the theoretical framework we mentioned on the previous slide. Now let's get a little deeper to go one step further. Research hypothesis in qualitative designs. Qualitative researchers typically make propositions rather than hypotheses, right? The researchers state their understanding as a part of the research process. These same propositions are revisited, tested, analyzed, and if needs be, reformulated throughout the research life cycle. That's the way of qualitative research. This runs counter to the quantitative research approach, which requires the hypotheses to be made upfront, typically. And that might be more of a textbook approach. We know we do adjust things as we go forward with our research, quant or qual. However, qualitative research is more about the process than the outcomes, and are less particular about significance testing and so forth. And that's enough for hypothesis in qualitative research design. Now, I want to briefly mention three research methods. In our next presentation, we will look at the different methods and try to apply to healthcare scenarios. So we have three methods here: a phenomenological, case study, ethnography. So the purpose of a phenomenological, to pronounce that word slowly with my Jamaican accent, a phenomenological method is to capture individuals' perspective of their lived experiences of a certain phenomenon. Notice, lived experiences of a certain phenomenon. And this might not be the perfect example, but say in massage therapy sessions over the last year, it happened over a period of time. Data collection would include interviews and observation while preserving the participants' perspectives. And then the outcomes highlight emergent themes from the participants' perspective, present verbatim while using a theoretical standpoint. And that might sound a little contradictory based on what I said earlier. So what do I mean by emergent themes? As you sort and organize the perspectives shared by different individuals at the vaccination site, for example, certain themes will start to emerge. such as differences and similarities between the different demographic groups. Some things will stand out. Some will be common among participants. These are what you will report verbatim. Within the discussion section of the paper or report you provide in your audience, the researcher then applies a theoretical lens. And the material should be presented of such in the findings section of the report or the article. It should be presented verbatim as to allow readers to apply different theoretical frameworks to the same. So we have, in a typical paper, you would have the findings section, and then you would have the discussion section. So in the findings section, the researcher presents to the audience or the reader the verbatim, the themes that emerge from all the data he collected and analyzed. And then in the discussion section, the researcher is able to apply a lens, say an intersectionality lens, that includes race and gender, an African-American woman or a Caucasian male, right? And look at that, the findings. Now, a reader who is interested in another theoretical lens, say a feminist lens, could see the findings with regard to the females differently. I'm stretching my example here. The second case study focus on a unit of study known as bounded system. There can also be collective cases. Example, massage therapy as a pain treatment for post-spinal fusion patients. Data collection, direct observation, and interaction with the subjects, right? What, how, or why something happened. And regarding outcomes, an in-depth description of the subjects. You try to be particularistic and descriptive. With regard to ethnography method, the purpose is to provide a holistic picture of social group, cultural characteristics or patterns of participants in their natural environment. Example, behaviors that relate to health and illnesses. And data collection with regard to ethnography method is to develop and maintain a face-to-face relationship with the participants and collect data through observing and interacting with subjects. So ethnography studies, you're more involved. You try to place yourself within the environment of the subjects, of the participants of your study. Regarding the outcomes, then use the concept of culture to provide detailed description of the social morals. And we'll talk more about these methods in our follow-up presentation. I just wanted to give you a taste real quick. So to finish off our presentation, let's look briefly at examples of qualitative research in healthcare settings. And I have 3 examples here, and they're brief. Qualitative research helps us to explore doctor-patient interaction, right? Example, my example. It's widely used in general practice to capture patients' and providers' perspectives regarding health and healthcare services. And the examples are patients' perspective of their interaction with a massage therapist. You can tell that I'm focusing on massage therapy in my research at the moment. And the second example is massage therapist's perspective of his or her interaction with the same patient. So the point is that one study, you're able to get the, I intended to put in my slide here, the provider's perspective of the patient's experience, and also, and the provider perhaps would be the massage therapist. And then we also get the patient's perspective of his or her interaction. So the first example addresses doctor-patient interaction or provider-patient interaction. The second helps us to identify changes in practice and patient behavior. So for instance, providers' hesitancy to prescribe opioids over the last 10 years. And another would be patients' hesitancy, say, to take certain hypertensive drugs in recent times, say in the year 2020. And third example, third way in which qualitative research can be applied in a healthcare setting is to observe and identify cultural and social factors that affect healthcare in the community, right? It's important that as a healthcare system, as a provider, that we understand the lived experiences, that we understand the background of our patients. It helps to serve them better, to relate to them better. We can have extended conversations on the practicality of conducting qualitative research within a clinical setting and other places. But this presentation, I think, gives us a chance to at least start this discussion. For my last slide, I adopted from a presentation on qualitative research methods I saw years ago. I went searching for this picture. I wasn't able, but this one is somewhat similar. So I want to open the mics to get your involvement for the next couple of minutes. But take a look at this picture and tell me what you see. Tell me what you see in this picture.
It looks like a hospital.
Yes.
Crowded.
Crowded. Mm-hmm.
Lots of people waiting.
Yes. What type of hospital you think? What at least
They look pregnant.
They look pregnant.
Lots of women.
Someone said poor sanitation. That is true, I think. So it is a hospital. I think it's in a third world country. What do you think of those things hanging over the beds? It's a maternity ward, I should say. What do you think of those things?
Mosquito nets.
Mosquito nets.
Good guess. Mosquito nets. They serve as mosquito nets. But they serve for one other thing. What could that be? And I don't know if it's true, but I heard this from that presentation. Here's a comment. Let me see what it is.
It could be some kind of demarcation for each patient.
You mean so to kind of separate the beds?
Yes, to separate the patient from
I've
the other one.
I've seen that. But don't quote me, but it is said that these are things that the ladies are able to hold on to as they go through childbirth, but anyways, from a qualitative perspective, you see that there are a lot of stories to be told from looking at this picture. And this is a healthcare setting, a maternity ward where babies are born. We have individuals all over the hospital. There are a lot of things behind it. What theoretical lens could one use to kind of present findings of such a study on this setting? I just wanted to stir your thinking and give us something to talk about. I think it sort of captures our point to what qualitative research is about. Again, this was just really an introduction to qualitative methods in healthcare setting. I am new to research in healthcare setting, so I hope I did the marriage as well as good enough for your understanding. But this is what I have to present. I'll stop sharing my slide.
All right,
if you have any questions, you can ask. Yeah.
I have a question.
Yes.
I'm guessing probably that might be answered in the next presentation you make. How, since you have different possible questions that could arise from qualitative studies, how do you generalize to the population?
Right. So there are qualitative journals out there, and the qualitative research is quite established. As I said, I alluded to it being systematic and following these certain steps that are common to research, but it's well documented. Again, the focus is on the process. You're trying to describe someone's experience rather than a certain research question. So it allows you then, if changing the question allows you to better explain what is going on in a maternity ward, then that suits the audience better than you. We mentioned type 3 question, type 3 error, where you're answering the wrong question, right? And that's the nature of it. It might be hard to digest if you're really a hardcore quantitative researcher, but it's documented well in the methods. They illustrate the validity of qualitative research. There are textbooks on this, and we could talk more about it in another presentation.
Thank you.